Hello everyone. In this video, will be useful for you to learn the role of vitamin D in pregnancy. Objectives. In this video, we'll learn about this introduction, functions of vitamin D, sources, risk factors, symptoms, metabolism of vitamin D in adults and pregnancy, recommended intake, complications, and how does vitamin D and deficiency correlates with GDM, preeclampsia, low birth weight, and neonatal complications. First is introduction. Among the most common problems facing public health today is a lack of vitamin D, which plays a role in physiological process and chronic illness conditions. Vitamin D deficiency in metabolic disorders has primary effects on osteoporosis, obesity, hypertension, diabetes, and cardiovascular disease. So, vitamin D deficiency, it causes osteoporosis, obesity, hypertension, and diabetes and cardiovascular diseases. Vitamin D acts as a co-hormone in various tissues of the body, and it has been found that vitamin D receptors are present on all cell types. Okay, vitamin D receptors are present on all cell types, suggesting that vitamin D has a wide range of effects on most cells. So vitamin D is a crucial for bone health, immune function, calcium and phosphorus balance. During pregnancy, its role extends to maternal and fetal health, including reducing the risks and complications. Okay. Next is about the overview of vitamin. What is vitamin D? What are its types? Okay. Vitamin D is a fat soluble vitamin. It has two forms, mainly vitamin D2 called ergocalciferol. It is found in plant-based food. And next is vitamin D3, which is called as polycalciferol. It is synthesized in the skin via sunlight, and it also found in animal-based food. So these are the two types: ergocalciferol, which is found in plant, and polycalciferol, which is found in skin, human skin as well as animal-based food. Let's see the natural sources of vitamin D. Okay, so we have four types of natural sources. Sunlight. Okay, the primary natural source of vitamin D. Fatty fish. Fatty fish like salmon, mackerel, and tuna are rich in vitamin D. Next, the natural sources, egg yolk, a good source of vitamin D, which especially from the free-range hens. And from the animal side, liver contains vitamin D, especially the beef liver. Okay, these are the natural sources of vitamin D. Next, we will see this fortified food. What are the fortified foods? Means already prepared one. Okay, milk and plant-based milk has vitamin D. Breakfast cereals often enriched with vitamin. Orange juices contains vitamin D, and yogurt also is available in form of vitamin D enriched varieties. So these are the fortified foods. The next is supplements, capsules, drops, and prescription forms with higher doses of for specific deficiencies are also available as vitamin D supplements. So that's about the sources of vitamin D. We saw about the natural sources, fortified foods, and supplements. Next, we'll see the factors that contribute to vitamin D deficiency. Historically, most people relied on sunlight exposure to produce vitamin D. Due to modern and indoor living and increased knowledge of risks of the skin cancers, people prefer limited sun exposure, and that leads to limit vitamin D production. The factors that contribute to vitamin D deficiency during pregnancy are lack of direct sunlight exposure, lack of vitamin D in diet, and genetic factors that limit the amount of vitamin D produced in the body. Some major factors like limited sun exposure, indoor working environment, sunscreen use, and sunscreen use that causes this thickness, sun protection factor increase. It increases the sun protection factors, and thereby the UV, the ultraviolet rays will not reach the skin. Okay, so the vitamin D production is reduced there. Sunscreen uses reduces the production of vitamin D from the skin. And the dietary choices, inadequate vitamin D3 supplementation, and geographical location. Especially when you see in the high latitude areas, we see that the sunlight and the ultraviolet radiation is less there. Okay, my mountainside and the plateau. Okay, those areas sunlight exposure is reduced. And time of the year, especially in the winter, the sunlight exposure is reduced. That also causes vitamin D production less and darker skin pigmentation. So these people have a melanoma in their skins, and that causes it is a natural protection against the ultraviolet rays. Melanoma in the skin is a natural protection against the ultraviolet rays in the skin. So that also leads to less amount of vitamin D production from the skin. Okay, so those are risk factors of vitamin D in pregnancy. The primary factors are sunlight exposure, diet, and supplements. Okay, less intake of vitamins, supplements of vitamin D3, and less intake of vitamin D in the diet, and limited sun exposure. These are the primary factors, and modifying factors are skin pigmentation. Skin pigmentation means melanin. Sorry, I was saying melanoma. It is melanin. Okay. Skin pigmentation or melanin reduces the amount of vitamin D that the skin can absorb. This is because the melanin absorbs the ultraviolet radiation that initiates vitamin D synthesis. Okay, so ultraviolet radiation is absorbed by the melanin. Okay, because of that, the initiation of vitamin D synthesis is not started in the people with high pigmentation or people with more melanin. Okay, that happens in the skin pigmentation, so there is less vitamin D. And clothing and sunscreen, because I already told you that is something called some sunscreen protection factor. Okay, so this sunscreen protection factors is increased use of clothing and sunscreen, so that the ultraviolet rays is not entering the skin. And pollution, season, latitude, I already told you. And smoking and alcohol, research have shown that in people with smoking and alcohol, there is less amount of circulating vitamin D. That's called 125 dihydroxyvitamin. That is very less in case of people with smoking and alcohol. So in drugs, okay, so the medication can cause either vitamin D deficiency, or by either speeding up the body's breakdown or of vitamin D, or reducing its absorption. So that's how drugs contributes to vitamin D deficiency. And obesity, what happens is this in fat and adipose tissue, the vitamin D is isolated and stored there, so that the circulating vitamin D is reduced. In bariatric surgery, okay, it is the surgery done for the intestine. Okay, it is mainly a weight loss surgery. Okay, it is done for the intestine, and the amount of this in the small intestine, the is resected and taken out. Okay, making the small intestine and small stomach smaller. Because of that, the absorption is reduced, and gut hormones is also reduced. Because of that, in bariatric surgery, vitamin D deficiency occurs. In malabsorption syndrome, even if we take enough vitamin D through diet and everything, because of malabsorption, it's not going into the bloodstream. In kidney and liver diseases, kidney secretes was something called 1 alpha dehydroxylase. Liver secretes 25 dehydroxylase. These two are very, very essential for conversion of pre-vitamin and then to the active form of vitamin D. Okay, so if there is kidney and liver disease, there is less amount of active form of vitamin D. In genetic mutations and SNPs, okay, there is something called as single SNPs are nothing but single nucleotide polymorphism related to vitamin D metabolism. These are related to vitamin D metabolism. It is essentially a protein. Vitamin D deficiency is caused by altering the functions of protein involved in absorption, conversion, and active form of vitamin D, leading to reduced levels of active form of vitamin D in the body, even with adequate sunlight exposure and dietary intake. So that what happens in the SNPs and in relevant gene conditions. So these are some of the primary factors and modifying factors that causes vitamin D deficiency in a pregnant woman. Next is the symptoms. Vitamin deficiency symptom is often asymptomatic. It doesn't produce much symptom. Severe and prolonged deficiency may cause following symptoms like lower back pain, pelvis, and lower extremities pain. And falls and impaired physical function, muscle aches, proximal muscle weakness, symmetric low back pain, and a prior history of PAH, GDM, small size baby, and previous baby having any musculoskeletal problems or rickets, etc. And also in obese women. Okay. Next, we'll see about the vitamin D metabolism. How exactly is this process happening? So I was saying something called pre-vitamin and something 125 dihydroxyvitamin. So how it is produced? So first step is major source called sun. Okay, from the sun, okay, ultraviolet rays is emitted into the skin. Okay, so and also in skin there is some factor called SPF, that is called sun protection factor. It ranges from people to people. It can be from 6 to 50. Okay, it ranges. And also if you use sunscreen, that is also going to affect. Okay, if you use sunscreen lotions, the sun protection factor will get increased. But in order to ultraviolet rays to reach the skin, okay, so the sun protection factor should be less than 8. Okay, so if the sun protection factor is greater than 8 and there is close or we are under the glass or something which hinders the ultraviolet rays to enter the skin, that is going to cause some decrease. Okay, so sun protection factor is preferably less than 8. So this ultraviolet rays enters the skin. Okay, the vitamin D is called as now pre-vitamin D. Okay, that is 7-dehydrocholesterol in the skin. Okay, so that is converted as vitamin D3 cholecalciferol. Okay, so that goes into the liver. Okay, from skin, this 7-dehydrocholesterol in the skin is converted as vitamin D3 cholecalciferol with the help of ultraviolet radiation. Okay, from there this vitamin D3 is converted into 25 hydroxy vitamin D3 when it enters into liver. So that enzyme is called as 25 hydroxylase, which converts vitamin D3 to 25 hydroxy vitamin D3. And from there it enters the kidney. So what happens in kidney? It has 1 hydroxylase and also parathyroid hormone. Okay, both this acts on this 25 hydroxy vitamin D3 and converts into 125 hydroxy vitamin D3. So that is the active form of vitamin D3 in the blood, which causes increased calcium absorption in the small intestine, increased urinary calcium resorption in the kidney, and increased bone mineralization. So for all these three things to happen, we need active form of vitamin D3 called 125 dehydroxyvitamin. So this is the this is the mechanism behind how the vitamin D from our skin, it is pre-vitamin, is converted into active form of vitamin. So from the diet, like vitamin D2 from the plants and supplements, ergocalciferol, and vitamin D3 cholecalciferol from the animal supplements also enters the liver, and with the 25 hydroxylate it is converted into 25 hydroxy vitamin D3, and it enters the kidney with 1 hydroxylase and parathyroid hormone. It again converted into 125 dihydroxy vitamin D3. So the same process is explained here. Okay, skin synthesis, ultraviolet B rays from sunlight is converted into 7-dehydrocholesterol in the skin into free vitamin D3, is then thermally isomerized to vitamin D3 and then transported to liver, vitamin D binding protein, and then liver hydroxylation takes place. It is converted as 25 hydroxy vitamin D, and in kidney, okay, so this 25 hydroxy is hydroxylated by again 1 alpha hydroxylase and produce 125 dihydroxy vitamin D, and this is the biologically active form. Okay, so regulation, parathyroid hormone stimulates 1 alpha hydroxylase in response to low calcium, and calcium and phosphate level influence the production, and fibroblast growth factor 23 down regulates 1 alpha dihydroxylase activity. So the biological function, as I said earlier, enhances calcium absorption in the intestine, regulates bone remodeling, and modulates immune system and reduces inflammation. So this is about the vitamin D metabolism in the adults, okay, normal adults. Now we'll see what happens in the pregnancy. During pregnancy, the metabolism of vitamin D3 undergoes significant changes to meet the demands of both mother and developing fetus. Increased demand for calcium, skeletal development requires large amount of calcium, particularly in the third trimester. So the placenta, what does is it expresses the 1-alpha hydroxylase, okay, which contributes to the production of active form of vitamin D. So this vitamin D crosses the placenta and support the fetal bone formation and immune development. Maternal adaptation, higher levels of 125 vitamin D, dihydroxyvitamin, are observed in pregnancy, especially in the third trimester, and intestinal calcium absorption is increased, and modulated immune response aids also increases. Okay, maternal fetal tolerance is there, and hormonal regulation is also increased. The estrogen and parathyroid hormone related protein is also increased during pregnancy. So this is about the metabolism both in normal adult and the pregnant woman. Now we'll see the recommended amount of vitamin D intake. So taking enough vitamin D during pregnancy is very important. Higher vitamin D intakes appear more effective and remain safe. So what are the recommendations? By Endocrine Society, it is recommended that 1,500 to 2,000 international units, and FDA 600 international units. Institute of Medicine is recommends 600 international units. Symptomatic, so that is for the normal, pregnant women without any, deficiency of vitamin D. So if there are some documented deficiency, it means if the mother undergone this vitamin D serum test, okay, and it shows that the vitamin D is less, then their treatment is different. Daily doses of 4,000 units per day are recommended for treatment in pregnancy in a documented deficiency cases. Use of lower doses of vitamin D like prenatal calcium preparations. It means like Chelcol. Those tablets are not enough in that cases. Okay. In a healthy asymptomatic woman, 1,000 to 2,000 international women can be supplemented daily in second and third trimester without fear of vitamin D toxicity and teratogens. Next we'll see about the complications. Maternal. So when there is vitamin D deficiency, there is increased risk of gestational diabetes, PIH, recurrent pregnancy loss, preterm delivery, primary cesarean sections, infections, and higher likelihood of postpartum postpartum depression. Next is fetal complications, poor bone mineralization that can lead to rickets, neonatal hypocalcemia, tetany, risk of low birth weight, reduced neonatal immunity, delayed or impaired ossification of cranial vertex. So these are some of the complications. Now we'll see how the vitamin D deficiency causes GDM in pregnant women. So the main thing what we have to study is that the diabetes autoimmunity study by Young, okay, he is a scientist, he reported that antibodies to islets, okay, islet cells are present in the pancreas, are correlated inversely with maternal dietary vitamin D intake during pregnancy. It means if autoantibodies to islets are present, via maternal dietary vitamin D intake is increased, okay. If it is not there, it is decreased. More direct evidence of this correlation has come from the Europe and diabetes study in which the vitamin D supplementation during the first year of life. Okay, after birth, the first year of life, the baby is given vitamin D supplementation. It decreases the risk of development of type 1 GDM. Type 1 diabetes mellitus. Okay, it is an insulin dependent diabetes mellitus. So if the infant takes vitamin D supplementation for the 1 year, it causes decreased risk of development of type 1 DM. In Finnish study, the children who received 2,000 international units of vitamin D per day during the first year of life has 80% reduction in the risk of development of type 1 GDM and follow-up period of 30 years. And in contrast, children who were deficient vitamin D or who were suspected to have rickets at 1 year had 2.4% increased risk of development of type 1 DM. So this is the correlation between the deficiency of vitamin D and the development of diabetes mellitus as well as development of GDM. One recent study shows the blood sugar balance was more easily achieved when sufficient blood levels of vitamin D. Another study also reported that pregnant women who supplemented with 5,000 international units of vitamin D3 once every 3 weeks, okay, about 2,400 international units per day, significantly improved their metabolic status, including fasting blood sugar levels and insulin levels. So, we see that vitamin D3 directly correlates with your blood sugar levels. So, see this vitamin D deficiency and PAH. Okay, the women with preeclampsia had a lower urinary calcium excretion, lower ionized calcium levels, higher parathyroid hormone levels, and lower 125 dehydroxy levels. Okay, that is the active form of vitamin D. So, if there is preeclampsia, the mother has hypertension during pregnancy, there is lower active form of vitamin D. Okay, and lower plasma calcium levels, it leads to several common mechanisms associated with hypertension, mainly renal renin mechanism is also affected, parathyroid hormone levels is also affected. Placental defects that cause decreased synthesis of active form of vitamin D plays a key event in the development of this disease by contributing to the decreased calcium levels. And also it causes the maternal death due to postpartum hemorrhage and many complications after pregnancy. Okay, let's also see how this vitamin D correlates with cesarean section. Complications and like preeclampsia and GDM increases the chance of cesarean section. Research shows that an indirect link between vitamin D and this alternative delivery method. One study showed that pregnant women with the deficient vitamin D blood levels were nearly twice as likely to deliver by this method compared to pregnant with higher levels of vitamin D. Other researchers reported that this was 4 times more likely. Similarly, pregnant women who took 5,000 international units every 3 weeks were 3 times less likely to deliver via alternative delivery method. Lower maternal vitamin D level were associated with increased risk of primary cesarean section, uterine atony, and postpartum hemorrhage. So that's about these complications of vitamin D deficiency in the pregnant woman. We saw how it causes GDM, PAH, and also alternative delivery method. Now we'll see how it affects the baby. Okay, neonatal outcomes. First is poor bone development. Vitamin D helps in the absorption of calcium, which is crucial for building strong bones. Deficiency in pregnant women who may lead to poor bone density in newborns, increasing the risk of conditions like rickets, a health disease that causes weak or deformed bones. Next is compromised immune system. Vitamin D is known to support immune function. Babies born to mothers with low vitamin D levels may have underdeveloped immune systems, make them more prone to infections and illnesses in their early years. Low birth weight. Several studies included those published in the Lancet have found that association between maternal vitamin D deficiency and low birth weight. Babies born with a low birth weight are at a high risk of developmental delays and chronic health conditions. Next is increased risk of preterm birth. Insufficient vitamin D levels in the pregnant women can cause increased the likelihood of preterm delivery and preterm labor and delivery. Preterm babies often face challenges such as underdeveloped lungs and has a higher risk of neonatal complications. Neurological implications. Emerging research indicates that maternal vitamin D deficiency may affect brain development in newborns. And lower level of this nutrient during pregnancy have been linked to a higher risk of developmental disorders, including delayed motor and cognitive milestones. Higher risk of allergies. Maternal vitamin D levels are thought to influence the risk of allergies and asthma in children. Babies born to deficient mothers may have a higher predisposition to allergic reactions and respiratory illnesses. So till now we have seen about the overview, introduction about the vitamin D, overview of vitamin D, the sources of vitamin D and the metabolism of vitamin D in normal adults and pregnant women, and recommended dietary intake of vitamin D, and also the complications, how it affects the pregnant women as well as the neonatal outcomes. So thank you for listening. We'll see in another video. Thank you.